Hello everyone, this is Dr. Abhinav, doing post-graduation in anesthesiology. So recently, I've seen most of them had asked me regarding part-time jobs or any other work that they can do because the NEET PG exam was postponed to July. So now you have three most important exams upcoming. One is INI-CET in May, and in July you have NEET PG and UPSC CMS. So you must be preparing for all the three or any one of them. So even in that case, you have a lot of time left because of the postponement of exam. So now you might have been not planning to work, but because of this postponement, you might feel that you can work for some more time just to save some money. And I'll be telling you regarding different options by which you can make a earning part time or as well as full time also. So I've just gone through the net, and based on my experience and my friends' experience, I've collected few resources which I'll be telling to you. And before we start, if you are preparing for any of these three exams, INI-CET, NEET PG, or UPSC CMS, the ebooks for these, the links are in description. You can go and check it. You can get the ebook by with the link given, and the details are also given in the description. Make sure you also join the Telegram group, and you can ask your doubts to me directly there or discuss with other doctors also. And yeah, so first of all, what I would suggest you to do is, if you, if it is possible, continue your preparation without working anywhere, because it disrupts the uh, pace of your learning, and sometimes people tend to go off track also. So I would suggest, if possible, just continue with the good work and keep learning and solve more previous year questions with the time that you have got. And in case if you want to do some other work in this time, then first thing I would suggest you to do is get a regular job from at least 8 hours as a medical officer in any of the hospitals, and try to work at least till March or April, because in May you have INI-CET exam. So if you are preparing for INI-CET exam, the ideal time to leave work would be March. So you will have 2 hours, 2 months of preparation time for INI-CET, and by this 2 months you can earn good amount of money if you're doing a regular 8 hour medical officer job. So that should be good. Or if in case if you're not planning to give INI-CET and directly you're planning to give NEET PG or UPSC CMS on July, then you can even extend your work till another additional 1 or 2 months. So which would be good enough for you. And so this is the usual thing which everyone does. And other things, if you don't want to get into an 8 hour job, and you have still a lot of preparation left to be done, so in that case you also have other options. So you can either work for 2 to 3 hours a day, or you can split your work throughout the day. So the working activities which you can do for 2 hours or 3 hours a day are activities like getting a job into a star hotel. So all the star hotels have a doctor at their hotel who comes there for 2 to 3 hours in a day. So you can apply in a place like that, but you can't directly go there and apply. So there are specific agents for it, which you can get to know from the Google website itself. So just type your city name and recruitment of doctors for hotels. So in those kind of job, what happens is that you go there and you be there for 2 to 3 hours. In case if there is any consultation needed, then the patients come to you, and that's it. So there would not be any difficult, like long hours of work, or most of the time you will be free, and you will also be paid nicely for on a day basis or on a monthly basis also. So this is a thing which you can do. The other thing which are available is working like dividing your work throughout the day. For example, like teleconsultations. So as obviously teleconsultation, it's not as easy as you think, because you initially have to go through an agent and apply it from them, get associated with any one of the websites, and then they refer patients to you. But most of them, since the degree that would be required is more, and as most of them are preparing for PG exams, you might be an MBBS. So the patient that you can get could be less, and the salary that you can get also could be less. But once it takes some time for you to establish yourself in this field, so that thing is also to be considered. The other or the third thing which I would suggest you to do is you can also go for home visits. So most of them might not be knowing you. So what an alternative that I am telling you is that you can go to the clinics that are there in your area, and in that clinic there will be some doctors. So those doctors get calls for home visits, but since they are very busy, they will not be able to go. In that case, if you are known to the doctor, or if you have already told to them, then they might refer those patients to you, and you can go to their home and see those patients and get paid for it. So this option is also there. But to do this, you will have to be talking to the doctors in the clinic in your area also. You can also apply through agents and become a doctor for patients in apartments. For example, in metro cities, there are groups of apartments where they will be requiring home visits. So there are agents you can check in Google also. So you can get hired by them, and then they will send you to see the patient, and you can also get paid for it very nicely. Other things, or you can go to nursing home visits. These things are also done, and I think most probably these things are out of the box things which I have told you. So there is another important thing which I would like to tell you also. So one of my friend was doing this thing, and so this thing, it will help you to learn also, and you can also earn fair amount of money. So this is that you have your juniors in the college which you have graduated. So those juniors will be having exams, and you can take special classes in Zoom or any other platform to for them, and for their exam preparations, viva preparations, practical preparations, and you can get paid for it also. So it's basically, you might be having contacts with your juniors. So just ask them in case if they need any special classes, and for an hour or two, you can make a group of 5 to 6 juniors and take classes for them. And you can take daily classes or weekly classes, however you are comfortable with, and you can get paid for it also. At the same time, you will be studying on those topics which you are going to teach them. So it also helps you gain knowledge about the subject and topic also, and it will definitely help you in your exams. So these are some of the important things that which can help you cross this tough phase of time, but make sure you should always remember your goal is not earning money for now. So it's NEET PG or INI-CET or UPSC CMS. So that goal should be very clear in your mind, because you sometimes tend to go off the track also. So make sure that you stay in the right direction. If you, if possible, make use of this time to learn previous year questions also. And other thing is also, other things that I want to tell is that don't try to read more and more. Just try to revise whatever you have read. That will definitely help you. So make sure whatever you know it perfectly. And revising previous year questions is also very important. And solve as many questions as possible. And you will definitely get a PG seat at your favorite college in your favorite branch. So all the best for you. So if you want ebooks, the link is in description also. Make sure you subscribe and join our Telegram group also. Thank you. All the best.